Good afternoon. I'm Jason Rogers, the Delaware County Emergency Management Director. This is the operational update from the Emergency Operations Center for today, Wednesday, March 18th. Before I get started, I'd like to introduce President Shannon Henry of the Delaware County Commissioners.
Good afternoon, everyone. I've been in contact with the other county elected officials today, along with officials from the state and officials from the federal government. With that being said, I want to make an announcement that we will be closing the county building, the Delaware County building, tomorrow to the public. You can still access the building by calling the appropriate office and making an appointment. There will be a phone list posted outside the building, and there's also a phone list on the Delaware County's website. So you can use those two places to obtain phone numbers for the appropriate office that you need to make an appointment for. So with that being said, I'll let Jason take back over.
Thank you, Commissioner. The Indiana State Department of Health today is reporting 9 new positive cases for COVID-19. This brings the total number of 39 Hoosiers that have been diagnosed through ISDH, the Centers for Disease Control, and private laboratories. 2 Hoosiers have died. The new cases involve residents of Clark, Fayette, Hamilton, Hendricks, Jennings, Lake, Madison, and Marion counties. Today, local elected officials participated in several briefings from state and federal government partners. Preparations for response from the federal government started back in January. I am pleased to make the following announcements. With novel coronavirus COVID-19 having been declared a federal emergency by the President, it has eliminated a few steps that will be required for disaster declarations. However, the Stafford Act has been enacted and every FEMA office is actively responding. Governor Holcomb signed Executive Order 20-04, outlining further orders and directives in response to the coronavirus disease epidemic. This executive order is viewable at dcema.com, and it outlines the activation of the National Guard, public meetings and open door laws access, price gouging, and many other important topics as it relates to this pandemic. Please review that document at the COVID-19 Hub at dcema.com. The state of Indiana has activated the EM resource to help state officials evaluate needs and allocate the resources that we have effectively. EM resource will be the primary method to receive requests and distribute resources as the COVID-19 response develops, and it is only now beginning to develop. Local emergency service departments have been encouraged to participate from the state level. We continually are updating our plans and information as it becomes available. Locally, we have activated the COAD group, which is Community Organizations Active in Disaster. This will be done to establish mass points of distribution, or pods. We have also appointed a pod manager to organize all these efforts. If you or your organization are willing to participate, please visit the COVID-19 Hub, our social media sites, or call the Emergency Management Office at 747-7719 to become a rostered volunteer and a COAD group member. Pods are being established, and there will be several locations in Delaware County to receive food in the near future. These sites are 100% dependent on people volunteering to help. Training and personal protective equipment will be provided at no cost. As those details are becoming confirmed now, we believe that the pods will be starting next week. Student-provided meals are being organized by each of the school districts, and if you have questions when and where meals are being made available for children, please contact your school corporations. We will post the meal availability from the schools on our COVID-19 hub as it becomes available to us. If you are not receiving our text alerts, sign up now by texting the letters DCEMA to 888-777. We are also advising, do not fall victim to fraud. You should only donate to locally established relief groups. We are hearing rumors of cell phone, email, and text fraud ongoing now. Now is the time to remain vigilant. Tomorrow's briefing will be specifically for medical personnel, long-term care facilities, and those who care for the most at-risk population. The Emergency Operations Center is engaging with the elected officials at all levels, hospitals, health officials, and the coroner. This is a 50-state effort, and every city, town, and county will be affected by this. We have activated the Comprehensive Emergency Plan and established our emergency support functions. All of these processes take time and are necessary for overall operational success. This is your local government and private partners working together. If you are well, take care of your family, your neighbors, and this community. Donate blood. Volunteer to babysit. Or volunteer just to do your part to be part of the solution. If you are sick or in a high-risk population, stay home. Rumors are not helping, so stay informed. The most difficult times are still ahead of us, so be patient and be informed. This is all for today's update. Thank you.